Start by washing your hands with soap and water or alcohol-based sanitizer and explain the procedure to the patient. Don a pair of clean gloves to prep the patient as needed. This may include loosening the oxygen delivery device and removing the trach cap or speaking valve. If the patient has a cap, place it in a specimen cup and leave the oxygen delivery device in place. Remove your gloves and perform hand hygiene prior to donning PPE. Appropriate PPE for suctioning includes at minimum a mask, eye protection, and sterile gloves. Sterile gloves are to be donned just prior to the procedure. Apply a disposable moisture-absorbent pad on your working surface and gather all necessary equipment, including sterile saline with cap removed or loosened, a sterile suction kit, and if needed, additional sterile gloves. Set the pressure between -100 to 120 millimeters of mercury. Suction pressure should be set as low as possible to effectively clear secretions. Perform hand hygiene and prepare your sterile supplies. Carefully open the sterile suction catheter kit and remove the sterile gloves. If using additional gloves, open them after opening the sterile suction kit. Don your sterile gloves away from the catheter kit. When donning sterile gloves, be sure to only touch the folded cuff edge when donning the first glove and under the cuff when donning the second glove. This technique is used to maintain sterility. With sterile gloves on, pick up the suction catheter and ensure you have good control of the catheter. Designate a clean hand to pour saline into the empty kit using it as a basin. Then with your clean hand, connect the catheter to the suction tubing while maintaining control of the catheter with your sterile hand. Irrigate the catheter with saline to ensure suction is working and to lubricate the catheter. Use your clean hand to remove the oxygen delivery device if needed. Instruct the patient to take a deep breath, and while leaving the thumb control valve open, introduce the catheter into the trachea. Advance the catheter until resistance is met, then retract 1/8 inch. Cover the thumb control valve to activate the suction while gently rotating the catheter as it is withdrawn. Do not suction for more than 15 seconds, and do not allow your sterile hand to come into contact with anything except for the catheter during the procedure. When finished, suction saline through the catheter to clear the line. Dispose of the used catheter and store the suction tubing appropriately with your clean hand. If your sterile glove is not contaminated with secretions, use it to replace the patient's cap or speaking valve. If it is soiled, replace your gloves prior to returning the patient's cap. Discard all used suction solutions and materials. Remove gloves and perform hand hygiene.